Hi there, I'm Robin Riddle with Brain Support Network, talking to you today from California. This is September 2022. I'm sharing this information with the MSA Coalition Conference. The MSA Coalition has been a great partner of ours for many years, close to 2 decades now. And I'd like to help you understand what some new and important changes have taken place in 2022 as far as brain donation is concerned, and also how brain donation can help families and researchers and how to go about making the arrangements for brain donation. So let's begin. There are two key reasons for brain donation. The first is that it's the only means possible right now for a confirmation of a diagnosis of multiple system atrophy. There's no blood test we can take, there's no brain MRI, there's no brain CT scan, there's no PET scan, there's no skin biopsy. There's no way right now to tell when someone is alive that for sure they have multiple system atrophy. And in fact, about 40% of the time when a neurologist says someone has multiple system atrophy, they're wrong, they're flat wrong. And so it's important to have a brain donation or have a postmortem examination of the brain if you want to have a confirmed diagnosis. This diagnosis can provide closure and peace of mind to the family. It can provide an explanation for what the symptoms that the person suffered from, as to whether it was caused by MSA or something else. And this diagnosis can be helpful to children, grandchildren, and siblings in the case that something genetic is found, which doesn't happen very often. It's actually quite rare for something genetic to be found. Another reason is that brain donation enables research into the causes, treatments, and cure for MSA. The diagnostic criteria today is only based upon those in the past who have donated their brains, and it's only as good as our support for brain donation is. Brain tissue is required in addition to providing for genetic analysis, imaging studies, and validation of future biomarkers. Again, it's the only way to know for sure that someone has MSA, and that confirmed knowledge can help a variety of research. I'd like to give an example, a couple of examples of brain bank studies where Brain Support Network has contributed significantly to these research studies. The first is a study published 7 years ago out of the Mayo Clinic. It was published in 2015, and it's called When Dementia with Lewy Bodies, Parkinson's Disease, and Progressive Supranuclear Palsy Masquerade as Multiple System Atrophy. There were 134 brains included in this study, and we at Brain Support Network provided 25% of the brains utilized in this study. So we're, of course, very appreciative to all the families and, of course, the people themselves who donated their brains. It's from this study that we know that a diagnosis of MSA while someone is alive is wrong about 40% of the time. That's really a high number. If you can think about any time you might go into the doctor's office and be diagnosed with something, you don't want to know that they're wrong 40% of the time. You'd like them to be wrong a lot less. If something like less than 5% of the time, you'd like them to be wrong if they have to be wrong. The most common diagnoses based upon this study done in 2015, if it wasn't MSA, that is, that the diagnosis was dementia with Lewy bodies or Parkinson's disease. There was another study also done by Koga out of the Mayo Clinic, and this was just published last year, July of 2021, and it's called The Clinical Features of Autopsy-Confirmed MSA. There were 171 brains included in this case, and it included 23 people who were not diagnosed with MSA during life, but instead were diagnosed with PSP, Parkinson's, or dementia with Lewy bodies. but in fact, these people had MSA, autopsy confirmed MSA. So from these 171 brains, we figured out, or the Mayo Clinic researchers figured out, that the diagnostic criteria for MSA needed fixing. And it confirmed that those with MSA pathology alone rarely develop dementia early on. So this was a conclusive finding that those with MSA very rarely have dementia in early stages of the disease. And early stages would mean the first 3 years. And again, in this case, Brain Support Network provided about a third of the brains utilized in this study. It was this study, among others, that figured out that the diagnostic criteria for MSA published back in 2018 was wrong. For example, the diagnostic criteria in 2018 said that there was an age cap of 75 years for MSA. And in the COGA study itself from 2021, we saw that there were 6 patients with a late onset of age 75 or older. And so those people would not have normally been diagnosed with MSA because the diagnostic criteria was incorrect. There was also a very high standard for diagnosing someone with the orthostatic drop in systolic blood pressure. The systolic blood pressure, if it was had decreased by 30 points, then we would say, oh yes, that person qualified for MSA. We discovered in that COGA study from 2021 that that was far too strict of a standard. A 30-point drop was not necessary to, in fact, have multiple system atrophy. There were other problems discovered in the diagnostic criteria. It didn't include REM sleep behavior disorder, it didn't include urinary retention, and it didn't emphasize the importance of erectile dysfunction in men. And so now we have, as of April of this year, 2022, new MSA diagnostic criteria. Again, this new criteria incorporates what we've learned through brain donation. And this new diagnostic criteria was only possible because of the hundreds of people in the past who have donated their brain or their loved one's brain and discovered that the diagnostic criteria needed updating. So we'll see if the future diagnostic criteria, if this diagnostic criteria published in April 2022 improves the diagnostic accuracy based upon that new criteria. So again, we want to really thank all of the MSA families who have contributed, donated in the past to this very important effort. Other research is made possible through brain donation. For example, we have the question I mentioned earlier is, can cognitive impairment be part of MSA? Can dementia be part of MSA? We know that dementia in the early years of MSA is extremely rare. And basically, if you have dementia and multiple system atrophy, and dementia being early on in the disease, say the first 3 years, then the chances are not high you have multiple system atrophy. The chances are much higher you have dementia with Lewy bodies or progressive supranuclear palsy, for example. Research also can answer the question of whether hallucinations and delusions are part of MSA. We know that they're, in fact, not part of MSA. We know through the brain donation that the expected disease course and prognosis of MSA is a certain way. And we can also use this research to enroll the right people in research studies. Imagine if only 60% of the people diagnosed with MSA actually have MSA, then what good is it to enroll those people in MSA drug trials when in fact 40% of them do not have MSA? So donating a brain requires the consent of a healthcare agent. One thing that's new and important for 2022 is that the family must provide neurological records in advance of the brain donation. So this highlights the importance of planning in advance. A pathology service must be available daily, and we need to know who's doing what, when, for how much, and why. Finally, all parties must cooperate in a brain donation. There are parties such as a funeral home or cremation organization, a hospice agency if they're involved, and a care facility if they're involved. And this is where Brain Support Network comes in, because we coordinate all the participants and prepare comprehensive instructions for every party involved. A funeral home or cremation organization must be cooperative, and that means that they must allow access to pathology personnel into the funeral home 7 days a week. Because the brain has to be recovered within 24 hours a day, we need 7-day-a-week access to a funeral home. And ideally, there's no charge to the family from the funeral home for accommodating the brain recovery. Some funeral homes do charge. We would consider a reasonable charge to be something like $100 to $250. Anything over $250, we would consider a very high fee, and we would encourage the family to perhaps make different arrangements with a different funeral home. We have in many of the major cities in the United States a list, an online list of cooperative funeral homes, and I put together it's a very abbreviated list. This is probably only maybe a third of the funeral home web pages we have, but you can see a variety of funeral home web pages. These are really only in major metropolitan areas in the United States. We're often asked for some remote area of Idaho or Oregon or Washington State, or many states in the Midwest. We're often asked about remote towns, and we don't really know very much about those because we don't do a lot of brain donations there, but we do many brain donations in the major metropolitan areas of the United States. And as I said, this web page, or this list here of web pages, is only about a third of the total number of web pages we have. We have many more web pages that I didn't list here for California. Since we're based in California, we probably do maybe 15% of all of our brain donations are in California. And we have many other places throughout the United States that we help with brain donations in. So let us know what area you're in, and if we can assist with a cooperative funeral home information. Brain Support Network recommends the Mayo Clinic as the brain bank. We do this because they're one of the top brain banks in the United States. They actively publish on MSA using donated brain tissue. I mentioned earlier that there were those 2 studies out of the Mayo Clinic. Those are just 2 of a variety of very important Mayo Clinic studies utilizing donated brain tissue. An important aspect of the Mayo Clinic is that they provide reports, neuropathology reports, to families within 100 days. This is a very fast turnaround. I don't know of any other brain bank that can provide such a fast turnaround. Many of the NIH-funded brain banks are required by the NIH to provide reports to families within 3 years. Yes, you heard that correctly, years. So you may be waiting 3 years to receive a report from your family member, and by then many other things have happened in 3 years. And so it's nice that the Mayo Clinic provides a report within 100 days. And we're delighted at Brain Support Network to help families to explain these reports to families, help families understand them, because they do use a lot of challenging scientific language and medical terminology. So in order to save yourself from looking up a bunch of words on Google, please let us know when you receive a report. We're happy to help explain it. And again, I mentioned that families have to order neurological records and provide these to the brain bank. The brain bank also asks every family to provide a written timeline of symptoms and complete what we call a family questionnaire or a family narrative. This is a very easy report to provide for most families who've been keeping very close track of symptoms and timeline. There are some challenges that I've kind of already hinted about with regard to brain donation. The first is that the brain has to be recovered within 24 hours of someone's passing. So this is 24 hours can be a very short period of time when the situation is already very stressful. And so it's important to make arrangements in advance because you don't want to be calling us after death has occurred, because then some amount of time's already gone by and we're scrambling and it's a very stressful situation. We're still happy to try to help you if death has occurred and you're calling us at that time, but always better to plan in advance. It's far less stressful for everyone. And as I mentioned, new in 2022 is that the Mayo Clinic now requires that all neurological records be at the brain bank at the time of the brain donation. Many medical clinics, major medical clinics, have online patient portals where records can be downloaded. And once a medical clinic learns of a patient's passing, generally online access to those patient portals is eliminated. And so it's very challenging to order neurological records after someone's already passed away. And many major medical clinics require death certificates to be provided. And with all of the work from home situation caused by the pandemic, the time frame for receiving a death certificate can now be on the order of 6 or 8 weeks. So it takes a long time. So that's why now Mayo is requiring that neurological records be provided in advance of the brain donation. Generally, families bear the cost of brain donation, and there's good news here on this front. In general, the cost to the family is about $750 to $1,000, and Cure PSP recently upped its grant amount to all MSA families to $1,000. So this is wonderful news because it means that in general, the cost is paid for in full by this taxable grant that comes from Cure PSP. And we can provide information about how to receive that grant. It's very easy to receive the funds. It's very important that advance arrangements be made because many organizations are involved. The funeral home or cremation organization, sometimes there's a body donation organization that's involved. There's a pathology service. We have to find someone who can do the brain recovery. And there's generally a hospice agency involved and sometimes a care facility. Unless you're lucky enough to have those neurological records in your physical possession or digital online possession, unless you know that the funeral home is cooperative, and unless you know that a pathology service is available to you 7 days a week, last minute inquiries about brain donation may not result in the brain donation. We may not succeed. We will certainly try, but the chances of success are far lower. So I'd like to suggest that you right now pause this recording, pause this webinar that you're listening to, and go to brainsupportnetwork.org, which is our website, and you'll see on the homepage 2 boxes on the left. You'll see a soon, S as in Sam, OON, or an immediate box. And I'm guessing that most of you watching this recording now are in the soon category. We hope that your end of life or your family member's end of life is not soon, but we really hope that it's not immediate. And so fill out that soon form that provides the name of the funeral home that you intend to work with. Or if you don't have one yet, you can list your city and state, and we can provide you with one of those web pages that lists the cooperative funeral homes in your area. You'll say on that form what your diagnosis is, and you'll say whether you live at a care facility or at home and whether hospice is involved or not. So it would be great if you pause this recording and went to the soon form, got that taken care of, and then came back and listened to the rest of the recording. At least that's my hope. So donating a brain requires, we at Brain Support Network ask every family we help to make a pay it forward charitable contribution. We ask every family for $500. Some families give a lot more than that. And we also are welcome any memorial contributions. So you can ask family and friends to make memorial contributions, and that would certainly satisfy the $500 pay it forward charitable contribution request. So again, we coordinate all participants, all parties involved in the brain donation, and we prepare comprehensive instructions for everyone involved. And for that, we request they pay it forward charitable contribution. We encourage you to start making brain donation arrangements when the donor is receiving hospice or palliative care. This would be a very good time. Has been hospitalized. Oftentimes, one hospitalization will lead to several other hospitalizations down the road, not too far down the road. And certainly when anyone is actively dying, that's the time to make arrangements. For MSA, it's certainly fine to contact us before a family member or before you are on hospice. Many people with MSA pass away and they're not on hospice at that time. So we encourage you to call us and help you make arrangements in advance. And again, if you go to our website, brainsupportnetwork.org/soon, SOON, that's the form to fill out so that we can start helping you. If you check out our website, there's also a whole section on brain donation. It's brainsupportnetwork.org/brain donation, brain-donation. And you'll see links on that webpage to a bunch of case studies. We have a lot of case studies where MSA was confirmed. I didn't count those, but it looks like it's close to 10 case studies now. You may find people that you've met at past MSA Coalition conferences when they were in person, or people that you've met at online support groups with people with MSA or their caregivers. So there's actually one case study there of somebody who was diagnosed with MSA during life, but in fact had Parkinson's disease upon brain donation. And we have two case studies of people diagnosed with MSA during life, but they actually had Lewy body dementia on brain donation. And both of those people, I know from case studies, both of those people had dementia in early stages of the disease, and they had hallucinations and delusions that were not caused by medication. And in the case of the gentleman who actually had Parkinson's disease, he had blood pressure problems, and he was unwilling to take Sinemet, carbidopa, levodopa. And so the family just assumed because he was unwilling to take it, that meant he got no response from it. And so he actually had Parkinson's disease and not multiple system atrophy. Those are kind of a shame when the diagnosis is wrong. And as I mentioned earlier, about 40% of the time, the diagnosis is wrong. It's not MSA. So I'd like you to check out our website, brainsupportnetwork.org. We have an extensive list of frequently asked questions and a process for brain donation document. And again, I ask that you pause this video now, this webinar recording now, go to our website and fill out the soon or immediate need form. It's brainsupportnetwork.org/soon or /immediate, whichever applies. Immediate gets our attention immediately. That generally means people are within a few days or a few weeks of end of life. And soon you're planning in advance. And it's not that we take our time getting back to you, but we run around a little bit less urgently, and we'll still get back to you within a few days, but that's a far less stressful situation for us and presumably for your family as well. Again, finally, about Brain Support Network, we were founded in 2004. We're a registered 501c3 nonprofit organization. We've been a nonprofit now for over 10 years. We have 7 employees. Everyone works from home. Most of us are part-time, but we do have a few full-time people now. We have dozens of volunteers. We're based in Menlo Park, which is just south of San Francisco. And we've organized incredibly over 1,000 brain donations. These are people both with neurological diagnoses and sometimes health and controls, which is a wonderful thing. So we've helped, as I said, over 1,000 people donate a loved one's brain. We'd be happy to help your family too. So this is the end of the recording. And again, I hope you'll go now to our website, brainsupportnetwork.org, and click on this soon, SOON form. And you just have to say, give your name, give your email address, a phone number that we can call you back on, and indicate you have MSA or a family member with MSA, indicate whether you're on hospice or not, and whether you're in a care facility or at home. And most importantly, indicate whether you have selected a funeral home, cremation organization, or body donation organization. And if you have not selected one of those, let us know the city and state you're in. We'd be happy to provide you a suggestion in the case that you're live in or near a major metropolitan area. We can certainly help out. So, and we'll get back in touch with you in just a few days. It doesn't take us very long. And we generally let people know immediately that we've received that form, and we'll be getting back to you as soon as we can gather some information. So thanks so much to all of the people in the past who have donated their brains for research. And thanks so much to the families for making that happen. And thank you to all the people who've already just now, in the midst of my recording, have put it on pause or are going right now to fill out the soon form on our website. We'd be delighted to help you. Thank you so much to all of the MSA community. We really value our partnership with the MSA Coalition and all of the MSA families in the United States and around the world. Thank you so much. Bye-bye.